Have you ever stopped to consider just how important your liver is to your overall health? Think of it as the body's very own chemical processing plant. This mighty organ is tirelessly working away, performing over 500 functions that keep us feeling fit and fine. It's a key player in digestion, breaking down fats and helping us absorb nutrients from food. It's also our personal detox unit, cleaning our blood of harmful substances like alcohol and drugs. But that's not all. Our liver is a metabolic superstar, regulating the balance of sugar, protein, and fat in our bloodstream. It's even involved in the production of cholesterol and certain proteins for blood plasma. With such a vital role in the body, maintaining liver health is not just important, it's crucial. So what happens when the liver is not in its best shape? Let's delve into the world of liver diseases. Imagine your liver is like a busy factory. Now picture a fire breaking out. That's similar to what happens in hepatitis. Hepatitis is a bit of a fire starter, an inflammation of the liver, often caused by a virus. But there's more than one type of this disruptive firebug. Let's introduce the usual suspects: hepatitis A, B, C, D, and E. Starting with hepatitis A, this one usually catches a ride through contaminated food or water. It's like the unwanted guest who overstays their welcome but eventually leaves without causing too much damage. Then there's hepatitis B and C. These two are the long-term tenants, often sticking around for 6 months or more. Unlike hepatitis A, they prefer the direct route, transmitted through blood, sexual contact, or from mother to child during birth. Over time, they can cause serious harm, leading to chronic disease and liver cancer. Hepatitis D is a bit of a sidekick, only showing up when hepatitis B is already in the house. Similarly, it's transmitted through blood and can speed up the progression of liver disease. Lastly, we have hepatitis E, which, like hepatitis A, is often spread through contaminated water. However, in certain cases it can become severe and lead to acute liver failure. Each type of hepatitis has its own set of signs and symptoms, from fatigue and flu-like symptoms to jaundice, where the skin and eyes take on a yellowish tone. But sometimes there may be no signs at all, making it a silent threat. Prevention is key here, folks. Vaccines are available for hepatitis A, B, and E. Safe practices can prevent hepatitis B, C, and D. As for treatment, it varies according to the type and stage of the disease. It can range from rest and hydration to antiviral medications. While hepatitis can be daunting, with the right precautions and treatments, it's manageable. So let's keep our liver factory safe and sound and keep the fire alarms at bay. Picture your liver trying to repair itself over and over again, but each time it leaves a scar. That's cirrhosis. Now let's delve a little deeper. Every time your liver gets injured by harmful substances such as alcohol or viruses, it attempts to repair itself. But this constant cycle of damage and repair leaves behind scar tissue, a process known as fibrosis. When fibrosis gets out of hand, it progresses to cirrhosis, a stage where the liver is heavily scarred and its function is significantly impaired. The primary culprits behind cirrhosis are chronic alcohol abuse and certain viral infections like hepatitis B and C. However, other conditions such as non-alcoholic fatty liver disease and autoimmune hepatitis can also contribute to cirrhosis. So what are the signs? Well, cirrhosis can be a bit of a silent actor in its early stages, often not showing any symptoms until the damage is considerable. But as cirrhosis progresses, signs start to appear. These may include fatigue, loss of appetite, nausea, and yellowing of the skin and eyes, known as jaundice. More severe symptoms such as confusion, bleeding, and swelling in the abdomen or legs indicate advanced cirrhosis. The risks of untreated cirrhosis are high. It can lead to liver failure, a life-threatening condition where the liver stops functioning. It can also increase the risk of liver cancer. But here's the silver lining. With early detection and lifestyle changes, the progression of cirrhosis can be slowed down. Abstaining from alcohol, maintaining a healthy weight, and managing underlying conditions can help preserve liver health. Medications to control liver damage and procedures to remove excess fluid or relieve portal hypertension are also part of the treatment plan for cirrhosis. In severe cases, a liver transplant may be necessary. Cirrhosis is a serious condition, but early detection and lifestyle changes can make a significant difference. And remember, taking care of your liver is taking care of your overall health. So, listen to your body and don't ignore the warning signs. When cells in your liver start to behave abnormally and grow out of control, you're looking at liver cancer. This is a condition where the cells in your liver have gone rogue, breaking free from the usual checks and balances that keep their growth and behavior in line. Liver cancer is not a single disease, it's a broad term covering a spectrum of cancer types that affect the liver. The most common type is hepatocellular carcinoma, or HCC, which starts in the liver's main cells, the hepatocytes. Another form is intrahepatic cholangiocarcinoma, a cancer that arises from the liver's bile duct cells. So, what causes these cells to go rogue in the first place? Well, the exact reasons are still under scientific scrutiny, but we know that chronic liver diseases like cirrhosis or hepatitis B and C can significantly increase the risk. Exposure to certain chemicals, alcohol abuse, and obesity are other known risk factors. Now, let's talk about the signs and symptoms. In its early stages, liver cancer might not show any symptoms. As it progresses, however, you might experience weight loss, loss of appetite, upper abdominal pain, nausea and vomiting, general weakness and fatigue, and yellow discoloration of your skin and the whites of your eyes, a condition known as jaundice. But here's the thing about liver cancer, it's a sneaky adversary. Many of these symptoms can be attributed to other, less serious conditions, which is why early detection is crucial. Regular screenings, especially for those with an increased risk, can help catch the disease in its initial stages when treatment is most effective. Speaking of treatments, they can range from surgery to remove the cancerous part of the liver, to targeted drug therapy, to radiation therapy. The choice of treatment largely depends on the stage of the cancer, the overall health of your liver, and your general health. Liver cancer is a formidable opponent, but with early detection and treatment, it can be fought effectively. So let's keep our liver healthy. And remember, knowledge is our best weapon in this battle. Imagine your liver getting slowly infiltrated by fat, hindering its ability to function. That's fatty liver disease. This silent threat is more common than you might think, and it's crucial to understand what it is, the signs, symptoms, and potential treatments. Fatty liver disease is a condition characterized by the buildup of fat in the liver, often linked to obesity or excessive alcohol consumption. It's like a silent intruder, gradually taking over the liver and preventing it from performing its vital functions. The real danger of this disease lies in its silence. It often shows no symptoms until it's too late, making it a stealthy adversary. But don't let its quiet nature fool you. The signs, although subtle, can be detected if you know what to look for. They may include fatigue, discomfort in the upper right abdomen, and sometimes an enlarged liver. The causes of fatty liver disease are varied. However, certain factors increase the risk. These include obesity, high cholesterol, and type 2 diabetes. In essence, it's often tied to a lifestyle that could use a few healthy changes. Now, what happens if fatty liver disease goes untreated? The stakes are high. The liver could become inflamed, leading to a condition called steatohepatitis. Over time, this inflammation can cause the liver to harden and scar, leading to cirrhosis, a serious and irreversible condition. Treatment for fatty liver disease primarily revolves around lifestyle modifications. This includes adopting a balanced diet, exercising regularly, and maintaining a healthy weight. In some cases, medication or surgery may be necessary. Fatty liver disease may be silent, but it's not invisible. Early detection and lifestyle changes can prevent serious complications. So while this silent threat lurks in the shadows, remember, knowledge is power. With the right understanding and actions, we can keep our livers healthy and continue to enjoy the vibrant life we all deserve. So, we've taken a journey through the landscape of liver diseases today. We've traversed the terrain of liver inflammation, where excess alcohol and viruses lurk as prime culprits. We've scoped out liver scarring, a silent battleground where relentless damage can lead to irreversible cirrhosis. We've also explored the rogue cell rebellion in the form of liver cancer, a formidable foe that can be tamed with early detection and treatment. In our journey, we've seen the signs and signals our bodies might send us, the warnings that something might be amiss with our liver. We've learned about potential causes, and most importantly, we've discovered the treatments and strategies that can help us navigate these challenges. But let's not forget the importance of regular checkups, and the power of a healthy lifestyle in keeping our livers in top shape. Remember, your liver is like a silent hero in your body. Take care of it, and it will take care of you.